everybody. Hello, everyone, and thank you for joining us today. I'm Harriet Sachs, the volunteer moderator for our APBD patient chats. We've met every month since January of 2014 to help each other by sharing ideas and questions, discoveries, details about having APBD. So let me set the stage for us today. 2 months ago, we learned about biosamples. The Foundation's research manager, Dr. Lindsay Gill, explained various kinds of biosamples like blood, urine, and nasal swabs, and how all of our community members would be asked to provide biosamples. Today, we're going to hear why it's important that our donated samples get labeled for storage and retrieval in a specific way and our role in that process. Our expert today is Grace Viggiano from the COMBINEDBrain organization. Grace is a biorepository manager and a research coordinator. Her talk today brings us a new and important set of initials, CRID, pronounced CRID. Grace, I am happy to see you on the screen. I'm happy to yield the mic to you. Thank you for being with us today. This is just terrific. Thank you.
Yes. Okay. Hi, everyone. I'm Grace Viggiano. As Harriet said, I am one of the biorepository co-managers of COMBINEDBrain and also a research coordinator. And I'm going to talk to you today about creating a clinical research ID, or a CRID. So we're going to call it a CRID most of the time because it's a lot faster than saying clinical research ID. And just really quick background on us. COMBINEDBrain is a 501c3 nonprofit organization that helps collect patient samples from rare disease communities like the APBD Research Foundation. And we work with all sorts of rare communities, and we just want to help collect biosamples, like Harriet said, and this is the first step to getting your biosamples collected, is creating a clinical research ID. So let's see if it lets me go. Yeah, there we go. Okay. So first, what is a clinical research ID? It is an 8-digit alphanumerical code that is patient generated for use in clinical research. It's completely free to sign up. It will always be free to have. You're never going to have to pay for a subscription or anything. And the reason that you need a CRID, or why we, like COMBINEDBrain, has really started doing CRID for all of our things, is that it's a really great way to de-identify your information for researchers, and it keeps your information private. So what I mean by that is when if we collect your samples, if we collect blood from you and a researcher requests it, when we send it to them, they need to know a few things about you. They need to know if you're male or female. They need to know the age when your blood was collected. They need to know which, if any, diagnosis you have. And so we need to be able to tell them that, but we don't want to tell them your name and your address and your, dog's name and all of that stuff. So they don't need to know all that. They just need to know the basics about you so that they can use that in their research. So what the CRID does is we can connect the CRID to your sample and say, this sample is A2B2C3D4. It is a female. They were born in 2003, so they're, oh my gosh, 22 right now. And they have this disorder, and this is their variant, or they are unaffected with a disorder. And then that's how researchers can know your information without actually knowing who you are. So it's really important for you to keep your privacy, and also researchers, so that they can get information easily from us. If they say, hey, who is this? Is this person a male or a female? We can look up the CRID, and I know who you are because I've taken all the proper trainings and you're in my database, but only I know. I'm never going to tell a researcher, this is Harriet. But I can tell them, oh, this sample belongs to a female who is 22, and that's why it's really important. So hope I explained that well enough. And then, oh, this is actually a slide that I thought I deleted, but this is just some of the biosamples that we can collect, but we can get to that later. We're just going to focus on the CRID today. Um, so we want to go over how to create a clinical research ID. I have put screenshots on this PowerPoint. If we want to later in the presentation, I can also go over it on the actual web page. But Harriet, I will share these slides with you and you can share them with your community so they can sort of follow along on the slides as well. But the first thing that you want to do is go to thecrid.org on either your computer or a smartphone. This is the computer view. I believe the smartphone view is very similar, but just so that you know, if you're on a smartphone, it might look a little bit different. And you want to make sure that you're going to the thecrid.org. Crid.org just alone is some kind of like Colorado driving thing. So you want to make sure you're going to the Crid. Once you're on the Crid, you click the Create an Account button, and I've highlighted it there for you. And once you click that button, it will have you input your email to request a new account. I want to just take a minute so everyone catches up to where I am. I know I can talk fast, so let me know if you need me to slow down at all. But yep, we went to the website, we clicked create an account, and then now it has us put our email address in. So the next step is going to your email, and this is sort of what the email should look like that it sends you. This is the one I just made it send me one so that I could show you. It'll say, please click this link to create your account. And note that the link will expire 4 hours after the email is sent. So you can't wait too long before going to this link in your inbox. I would like you to note, we've had trouble in the past, just once in a blue moon, the email just like will take maybe 5 to 7 minutes to show up, which is not, it usually takes around 2 minutes to show up in your inbox. If it's taking a long time, give it maybe 5 to 10 minutes. Make sure that you check your spam folder or any other folder it might go into in your inbox. But if you don't receive an email entirely, you can try to re-request one. But if it's really not working, please contact a COMBINEDBrain staff member. And I'm going to have all of our contact info in the last slide, but definitely don't hesitate to reach out because we want to help you with this. I don't think that will happen to you, but just in case it does, don't freak out. You're not the first person, and we will help you. But anyway, so after you click this link, it'll take you back to the CRID website where it will have you create an account. And I'm just going to put this up a little bit bigger so you can see it. You'll put your email address. It'll have you, obviously input a password, first name, last name, and then a optional backup email if you'd like that. Pretty straightforward. This is what you usually do when you create an account on anything. So the next step, after you create an account, it'll take you to this My CRID dashboard. And I don't know if you can see my cursor, but in the little toolbar here, you're on the My CRID tab of the dashboard. And then it will let you click Add a New Person. And this is where you can add yourself or anyone who would be donating biosamples. So when we click Add a New Person, this is what will come up. There's a few required fields, and then there are a few optional fields. We're just going to go through them. Nickname, we don't know why, but it's required. So just put anything that you want. You can put something silly. You can just put your name, but it is required and it will not let you make a CRID if you don't put your nickname. And then first name, last name, sex, and date of birth. Then on this, I'm also going to just go through kind of, I know it's a lot of writing, we're going to go through it, but this is sort of just to take you through the optional ones. So obviously nickname is required. I just want to note that because sometimes people won't put that and they're like, why isn't it letting me create the account? You just have to put a nickname. Then the disease, this is all optional. So you can click save after filling out the required fields that have the little red asterisks next to it. It's good to fill this out, but if it is too hard, just don't worry about it. Click save and get your CRID created. Just don't worry too much. But if you want to, in the disease name field, if you are affected or diagnosed with APBD, you can put APBD, or adult polyglucin body disease, or whatever you'd like your diagnosis to be. If you are unaffected, I don't know, Harriet, if you're planning to collect from any control samples, but just in case, that's where you would write control or unaffected or like NA or whatever you'd like. The gene, I think that GBE1 is all of your genes, perfect. So put GBE1 for your gene. And then your variant, this is where it can get a little tricky, and really don't worry too much if you can't figure it out. On your genetic report that you got, if you have been tested and diagnosed with APBD via like a genetic test, they will have a variant on your genetic report. You can put that in here, but sometimes it's difficult to figure out. Some reports don't have it very clearly listed. So really, really don't let that step trip you up. Just don't fill it out if you can't figure it out. It is not a big deal. And again, you can always ask us to look at it with you, but it's really not a huge deal if you don't fill out variant on this form. And then again, if the person is unaffected or does not have APBD, they can write control or none or whatever they need. And again, I put in big red letters, if any of the optional fields are confusing, just don't worry about it. You can always edit it later if you need to. Then next is congrats, you have created a CRID. It will show up like this, and this is the one that I created. This is my little example patient, but this is now 43GX SYF1 would be my clinical research ID. So anything that I give would have that ID, and I had my de-identified information. So nothing about me being Grace or being born in October or anything like that, but it would have that I'm a female and that I'm 27 and then I'm a control participant. And then if you need to, if more than one person in your family is giving, or your spouse is giving, or whoever, you can click add a new person and just add them on the same account right away. You can add as many people as you need to on one account. But then it would just do the same thing. It would just take you back to this screen and you'd add them, and then you'd have another CRID on your account. And then after you complete that CRID, the next step would be donating biosamples with us, and you're going to use that CRID on your consent forms with us, and we will use that CRID to identify you, like de-identify, but like you would know if you see your CRID in any like research studies or anything, you know that that is you. So it's also kind of cool if there are any studies that come out and, you know, years from now, and they have a table, you can say, oh, that one's me. And so now I get to see my information in this research study. And I think, yeah, it's kind of a quick presentation, but don't hesitate to ask us for help. Please, please contact a research coordinator if you have any questions. I put my name obviously up top, and then I also have two of my colleagues in case I somehow miss your email, because now we know that I'm good at missing things. So, and then we have Ashi and Kathy. And that's the end of my presentation. Should we go over anything again? Any questions right away?
I've had some questions come in to me
Perfect.
by text. So this is Harriet,
Hi,
and I,
Harriet.
on behalf of unnamed people, first question: do I get one CRID for life?
Yes, that is the goal. You should get one CRID for life and always use that CRID. Something that I didn't mention is there are other not companies, but like organizations within the rare disease world that also use the CRID. And so you can use that same CRID that you got for us for every other study that asks for a CRID. Always use the same CRID and try to never make a new CRID, because then we'll have you listed as two different people. If you were de-identified and you had two different CRIDs listed, you would be technically listed as two different people. So we definitely don't want you to make another one. Only make one CRID, and that's yours for life. Good question.
Well, related to that is the next question that came to me. How important is it for me to not lose the CRID? Is this like losing the identifier for my um, freezing my credit report or
Yeah.
something like that.
So it's not your social security number. So that's like it's important, but you like don't have to like panic and go into panic mode if you lose it. One really nice thing is after you click this link and you create your account and you create a clinical research ID, it will actually email you your clinical research ID as well. It will email you exactly like this little thing here and say, thank you so much for creating a CRID. Here's your CRID. So that's very helpful because you can hopefully you don't lose access to your email ever, but you can look up in your email CRID. You can just search CRID in your email, and this will come up and it will have your clinical research ID. So that's really good too. I would, if you have like a password book or any sort of area where you put important documents, I would maybe just put a post-it or something in that has your CRID on it just in case you ever lose it. Um, we'd like to try not to lose it, but things happen. And if you do, you can contact one of us. We can try to, if you've donated samples with us, we might have it on file and we can help you find it. Or worst case scenario, you can make a new credit and we'll figure out where to go from there.
Okay, and this is Harriet speaking again. Let me just say a great place to put something like this is in your sock drawer. Okay, you just tuck that little piece of paper inside the sock drawer. You're going to remember it because who thinks about sock drawers? Everybody does every day.
Yeah,
Okay,
that's a great
We
place.
we have a question in the chat about where this is based.
Oh, where the crit is based or where combined brain is?
Well, maybe both.
Maybe both. So combined brain, we are so we actually all work remotely. We're a sort of like small nonprofit. It is technically based in Nashville, Tennessee. We do sometimes partner with the Vanderbilt University Medical Center. I myself am actually in Colorado. I work remotely, but and then the CRID, I actually would have to let me look that up because I'm actually not positive where they're based. That's a really great question. And if you want to ask another question, while I look that up, you can, but I will have to consult my phone on that
okay.
one.
Well, why don't you hold that toward the end? We'll come back to it. We'll put it in the parking lot for now. Um, Calliope, are there some more questions? Because I still have two.
Yes, just for the recording purpose, I see that we mentioned CRID is based in the US, but it can be used by US and international patients. So that is the question.
There you go. Thank you so much, Calliope.
Another question that you've got in your on your side, Calliope?
No, go ahead, Harriet.
Okay. My child, who is a carrier, was identified as female at birth and is transgender. What is the sex that needs to be indicated in this
Um, I
identification
believe
process?
that you can click other. And I'm pretty sure that it will like bring up a little thing that you can type that in or you can just click other. That's a really great question. That's really important for us to know. It would be important to us to know what someone is assigned at birth. Just for like if we're looking at like developmental during childhood, anything with that, it would be important for us to know. But it's also really important for us to know what they currently identify as. And actually, so on the CRID, I believe it might just be that you click other. But when you actually consent with us and you do our consent forms, we have a way more kind of like robust question process for that. We would ask what you were assigned at birth, what you now identify as, and anything else to do with that. And that's very important information. So thank you so much for asking that question. We definitely want to know. But yeah, for the CRID, I would maybe just say other, or they could say anything that they're comfortable with. They could say the sex that they currently identify as. I think the CRID it's most important for all of this information that you're inputting on the crid.org. It's just to get that clinical research ID. So I don't know how important it is to have everything perfect on that specific little card. It's not as important as having it on our consent forms and in our consent database. But thank you for that question.
So you're saying this is not the last bit of identifying information that's going to be required of a patient. This
Yeah.
is the front end. And
Yes.
then when the samples are actually used, there may be or will be.
Yes, there
more?
will be. Yeah, so this is just to get your de-identified 8-digit code. When the next step after this is creating an account on our Matrix portal, which I would be happy to come back at a future date and explain Matrix and everything. But yeah, that is where you are going to be asked a lot more like robust questions about multiple things, but also like including like sex and gender identity. And that will be recorded. If you're comfortable, you can always say prefer not to answer. But if you're comfortable with that being recorded, that's important information for us to have.
We have a question in the
Excellent.
chat. Could you explain how the samples are utilized, how the samples are actually used in research?
Yes, so it depends on which samples. And actually, it's good that I didn't delete that sample page because here's all the samples these are all the samples that COMBINEDBrain collects and has the like capacity to collect. This is not what you would be giving necessarily. Like not all of you will be doing all of this, but it depends on what your research foundation is looking to collect. Harriet, do you have any idea? Have you at all thought about what you might collect from your community, or should I
We
just
do
go?
know. We do know.
You do?
It would be a urine sample, a blood sample, and a nasal swab.
Perfect. Yes. Great. So that is what most of our communities collect. And the question, just to reorient myself, is what are they used for and how are they used? So yes, so we collect blood in the form of whole blood, which is just blood from your vein in a tube, nothing else is done to it. Plasma, which is where we spin it really fast in a centrifuge and the like blood plasma separates out, and it's like a sort of like a little golden liquid. So we use plasma. And then also, as Harriet said, urine, and then nasal swabs. They're eligible for a number of studies that we do that we have like ongoing. One of them would be the biomarker study. I think that you are eligible. I'd have to check with your exact organization. But the biomarker study looks for, I could actually pull up another PowerPoint if we want, but it looks for what a disease biomarker is like a small molecule or something that can be indicative of a disorder. So one of the really well-known ones is for Huntington's disease. If you have CAG amino acid repeats and you have enough of them, that is directly indicative. If a scientist sees those repeats, then they can diagnose you with Huntington's disease. So a lot of these rare diseases that we work with don't have something that they can just say, oh, this protein is more highly expressed or this level of this is whatever. That means that they have this. So what we try to do is we try to find disease biomarkers in the plasma, in urine, if it's metabolized out of your body, and that can make it easier for it to be diagnosed in patients going forward. It can be used to target disease treatment if we know that something, for instance, if we know something is overexpressed in the body, if a protein's overexpressed, treatment can be targeted to say like, oh, like if this is overexpressed and it causes this, then how do we stop it from being overexpressed? And that might be able to treat or cure a disease. So it's really important for like targeting treatments, targeting cures. So those are the biomarker studies. The nasal brushing is we have partnered with a company called Unravel, and they do a little nose swab, and we send it all to them. And I think that they're looking at RNA sequencing and trying to do the same thing that we do, is just figure out more about the disease, see if there's things that we can target treatment for, or see if there's things that we can have as a diagnostic tool. So hopefully that answers your questions. And then also, when we collect your biosamples, say that we collected plasma from you. When we get plasma, and I actually have a prop, this is perfect. We collect plasma in a big tube like this. And so when we collect that plasma, we put it out into little tubes that are 1 milliliter big. So just for a size reference. So one of these makes about like nine little tubes of this. And for the biomarker project, we usually only use like 1 or 2 of these tubes, which means that you have around 7 left for other purposes. We put a sample catalog on our website that researchers, that's available to researchers. Researchers can see maybe someone at Harvard is interested in APBD, and they look at our website and they see, oh wow, they have some APBD samples. I think I'd really like to try to order some plasma and do some tests on it. They can purchase the plasma from us. We send it over to them and then they can analyze it for whatever they need. We wouldn't necessarily like get that information back right away. It's if they were to publish a paper or, come out with any findings, then you would be able to know what they tested on, but we wouldn't be able to really tell you right away.
Okay, another question that did come to me. I have 2 variants. There, and now I'm going to add in individuals can have 2 different variants, by the way, Grace, or they can have the
Oh,
same variant
gotcha.
twice. So talk to us about how you identify in that line that says my variant or
Yeah,
variants.
definitely. You can put both of them. Harriet, would they be in the same gene still?
Still the same gene.
Great. So yeah, so that's very easy. You would just be able to, I don't know if it has a character limit of how much you can write, but I think that you would definitely be able to just put both variants in, and you can say they're for the same gene, or you can just put both variants in. But that's very important for us to know as well. And thank you, Harriet. Yeah, I didn't know that people could have double variants in this gene for your disorder.
Yes,
That's very
because
interesting.
it's a recessive disorder.
Gotcha.
Um, so related to this, one of the variants that a minority of our patients has, well, I'll start at the beginning again. Most of the variants have, 6, 8, 9 characters. It's nothing big. It's easy to type. But one variant is is known as the intronic variant. And when you write it out, it's actually something on the order of 29 characters.
Yeah.
Okay to just write the intronic
Yes,
variant?
definitely. Absolutely. If you're able to, sometimes you can copy and paste from your genetic report if it's the right like file format. But yeah, absolutely just write intronic variant. You don't need to sit there and like match all the numbers and letters that are going on because I know it can be very, very long. And
Okay.
then that is something that after you donate samples with us, you'll also upload a copy of your genetic report. We can do the difficult, like, putting it all in part, but you don't have to worry about that at all.
Okay. Let me speak on behalf of people who are not necessarily comfortable technologically. This looks to be only a, 5, 6 step process, which is easy for anybody who is comfortable doing that, but it may not be easy for some of us, a lot of different reasons. Is there a way that an individual can get hand-holding from the
Absolutely.
get-go?
Yes, we are absolutely, absolutely. I can actually also, maybe Harriet, I can send out some links. We have Google Meet links that someone can meet with us and we can take them through everything on the phone. We do that all the time. That's one of like the biggest things we do at the Biorepository is taking people through the consenting process. So I didn't include the links on the last slide. Let's go over there. I included our emails, but I can maybe send you those links so that people can just directly click. All you would need to do is click the link and it will give you times that that person is available to meet and click a time, write it down somewhere to remind yourself and just join the meeting at that time. And if you're really, really not tech savvy, we can also just give you a call on your phone if that would work better. Yeah, we can do anything that you need to help you through it. We know that this can be sort of overwhelming. So definitely don't hesitate to reach out. And if you can't get on a Google Meet on your computer, we don't mind calling you on your phone if that works. We'll do anything to help. Yeah.
Go
Oh,
ahead.
great. One is, Grace, could you explain again about adding a new person and why it would be used? For instance, if I have a sister with APBD, should she be added so that we're linked?
So great question. This you don't need to add on the same account. If your sister would like to make her own account and have her own CRID dashboard, she can absolutely do that. This is for if it's easier for you to just put it on one account, you can absolutely do that. This is also if you have any like dependents that you put on your account. It can really be used for anything. This won't link you in any way, just being on the same like email address. It just is a way to get the CRID created and generated. So your sister can either create her own account, go through all of the steps on the PowerPoint, or if you want to do it together, one of you can create an account and then put 2 CRIDs. The only thing to note with that is that then only whoever's email you signed up with, that would be the email that it would send the CRIDs to. So if you sign up on your email and your sister needs to find her CRID one day, you'll have to look up on your email and find her CRID on your email. That's the only potential thing that would happen with that.
Thank you. We have a few more questions now. Is it possible that once all the available samples have been utilized by different research samples, that more samples will be available?
Or available or need to be collected?
I think
maybe it's collected.
Yes, the question's framed as available, but it might possibly be that more samples need to be collected.
Yeah, I think so. Yes, that is, if that happens, if you guys are super popular and a ton of researchers are interested, which is what we want, yes, there is a chance that you'd have more samples collected. We also, a lot of rare diseases are, I think that this is a degenerative, am I correct, disorder. So that means that as the years go on, the disease might progress. And it's actually really important, regardless of if your samples are already used up, to collect once. We recommend like once a year, maybe once every 2 years, because then you can see these are the samples I collected in 2025. Here's what it looked like. And then in 2027, here's how my samples differed from 2025. Maybe something you can see a change in that. So those are what we call longitudinal samples. They're very important. And we would definitely recommend, if you're able and if you're willing, to give samples as much as your foundation requests them, if you're able to.
Thank you. We have a question, actually 2 questions about the labs that you work with. One question is if you contract with certain labs for sample collections, and another is if you send the orders to certain labs.
Okay, yes, let's see. So for sample collections, we have not really a lab, but we have a mobile phlebotomy service. So there are a few ways to get your samples collected. One is a mobile phlebotomy service where if you we are contracted with a thing called Travel Lab. They have phlebotomists all over the United States. So if you're in Illinois, they would say, hey, there's a person in Illinois that needs to be collected. Here's a phlebotomist that lives near them. Let's get them in contact. And then the phlebotomist would, or we would send you a home collection kit, which includes all the supplies that you would need. And then a phlebotomist would come to your house, collect your blood, and process it there, spin it and everything, and then take it with them when they leave. And that's all you have to do. It's really like not a lot to worry about with, you don't have to ship it or anything. Let me reorient on the question. You were asking, what labs we work with. Yes, so we do have some contracted labs like that, but they're not keeping any of your samples. They're not like, getting any of your sensitive information. They're just sending it all to us and our Biorepository, which is a biobank. It's where we house all the samples. We have like almost 40,000 samples in this facility in Michigan. And then your other question was, so it was, do we contract with anyone? And then
Yes, and actually we had a follow-up to that, which is about the folks living abroad. So outside of the United States, how do they provide you samples?
yes, definitely. I'll get to that one, but I think in the one I just answered, was there another part of that question? I want to make sure I didn't miss it.
Where you receive so you talked about sample collection, but then do you send orders to certain labs?
Oh, like if you were at your like physician's office and we could send an order to the lab? potentially.
We want to emphasize that the step one is to get the CRID. All right.
Exactly. Yes.
This is why we're here today. Step two is by getting the biosamples that will follow. But until the CRID is established, there's nothing
Yeah,
else
you
to
don't have to
do.
worry about
You're
anything else.
right. So let's really focus on step one. But please go right ahead, Grace.
No
for you
worries. Yeah, so
address step two.
definitely focus on step one. I'm glad that we're thinking ahead that shows interest in collecting the samples. But yes, step one and what your homework is for today is creating your clinical research ID. But let's just pull up
I'm going to make sure everybody understands. I have all this information. You simply don't have to copy down from the screen. This is recorded. It will be available on our website. In addition, if you're not comfortable going to the website and you have questions, you know how to get in touch with me. So don't be shy. This will probably be published by me to all of our chat members. Very likely there will be an article in our newsletter to reiterate this, that we're going full force, guys, because getting the CRID step one is very vital for every member of our community. And then step two, getting those biosamples. But we'll start with step one.